Hello, and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Jessica Adams. Joining me today is Dr. Laurence Slama for a discussion on a strategy she is using to make the dosing of long-acting injectable cabotegravir and rilpivirine more sustainable for her clinical setting in France. Dr. Slama is a physician in infectious diseases in Paris, France. We'll discuss the logistics of how she is allowing patients to seek a nurse in their community to administer their long-acting injectable ART after receiving the first few doses in a clinical setting. For the full online educational program, please visit the link in the show notes for this episode. So, Dr. Slama, let's get started. So I think it would be really great to hear about what you're doing as far as you mentioned that you do the first few injections in your clinic, and then after that, you give your patients the option of finding somebody to do the injections closer to where they live or work. And I think that's really interesting, and it's not something that everybody is doing quite yet. So I think it would be interesting to hear how you're doing that, how many patients have actually taken you up on that so far, and how that's worked for them, and then kind of where you see that going in the future and the benefits of that.
So first, it depends on the country. So you have to say that in France, it's mandatory to have the first 3 injections on site in the clinic, in the hospital, okay? And then the patient is allowed to have the injection either in the hospital or outside the hospital with an outpatient nurse. Okay? So most of our patients are still in our unit because of the stigma, because they don't want to explain someone else that they are HIV infected and they need this treatment because they are HIV infected. They prefer staying with their nurse. And, they know, everybody knows, so it's more confidence to stay at the hospital. But during the COVID pandemic, and because of certain patients who don't want to come often at the hospital, we can tell them to go out and to have an injection outside. And for me, this is the future because we cannot keep all the patients with us. So we ask the patient during the 3 first injections to organize it himself and to look around his place, his home or his work, to find a nurse who will be agreed to do the injection. Then, so the patient is looking. We usually had an appointment, the nurse from my hospital with the nurse from the outside. They call each other, and the nurse from here explain how it works to make the nurse more familiar with the treatment. And then the patient is going out and has his next injection. But the problem, you have to remember that he has to go to the hospital to take the drugs, then go directly to the nurse to have the injection. That's why I think we have so many patients staying at the hospital. Because if, they could have the drugs at home, it will be a different thing, I think. Because the rilpivirine, you keep the rilpivirine long-acting in the fridge, it has to be next to someone who can deliver the injection as it's mentioned. The authorization, it needs to be conserved like this in the fridge, and then you keep it out from the fridge at least 15 minutes before the injection, because you need to have it in ambient temperature before the injection. So some patients ask the pharmacy, go to the nurse and decide to go out. But I would say it's 8%, 10% of the patients. So it's very few patients decided that. But I think this has to be, because we won't be able to do all the patients in the future. Or we will decide not to give the treatment because we will be too much busy. So it has to be in this way, I think.
When they get they have to come to the hospital to get the medication. They're not able to get it from a pharmacy, a local pharmacy.
They can go to they can go to a pharmacy. They can get it.
Okay.
And then Then, but you cannot, say, okay, it's not like you go to the pharmacy, you put it in your pocket, and it's like having a vaccine. When you buy a vaccine, you buy it, you go back directly to the doctor or directly to your home, put it in the fridge, and then you can use it. A vaccine is a vaccine, but the HIV drugs, you have to be careful because, you have one injection every other month. So if it doesn't work, my God, this is a huge problem. So usually we don't say that. We say, okay, you go to the pharmacy, you take your drugs, you go directly to the nurse, and then you have your injection.
I see. So in France, the pharmacists themselves can't inject it, right? So they can't.
No, they can't. No.
And the nurse.
But you can find a nurse who can have a fridge, and you can stock your drugs in the nurse place. And we had another way. We had some nurses who went directly to the patient's home to do the injection. But they don't like it because you'd have to wait for the nurse. You prefer that the nurse wait for you than the opposite. It's true.
So how have they found the nurses? Is it typically somebody they know, or do you have like a list or something? Or
you have a doctor leave, for example. You are looking for a doctor or you are looking for a nurse. And so you go around you and you find someone and you call, can you please do that for me? And it's very easy to find a nurse. They are very busy too, the nurses. So sometimes they say, no, I can't, you're too far, or it doesn't work for me. But you have, a lot of companies who can work with people. So if you have time, it's difficult to find a nurse for tomorrow. But if you are organized, and with long-acting, you have to be organized. You have time, at least you have 6 months to find someone you trust, someone you can organize with, you can plan, you can make the planning of the next injection. So this time is very important for the patient and for us, to allow them to go outside the hospital so we feel safer.
Are the nurses usually associated with like a local clinic, or they're independent?
Independent.
Okay.
Yeah, independent. But, for example, I was asking a nurse, how much do you take for an injection? And they said, okay, it's €6. So it's nothing.
Oh, okay. And the patient pays that. That's not covered by like an insurance.
Yeah, it's covered. But you spend more time with the patient. So you don't have a lot of money at the end of the story. But you need to be interested by the patient. You need to be involved eventually with HIV. You need to think about it before, saying yes. Because you have all this time of preparation and waiting for, having it in the good temperature. So I would say not all the nurses will want to do it. But it's pretty easy to find one.
Thank you very much to Dr. Slama, and thank you to our listeners for joining in. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you and have a great day.